This is not going live, my dear. Have you checked?
Yes, ma'am, I have checked.
मुझे तो notification नहीं
Just a
आ रहा.
second.
हाँ, okay, yeah, it's coming, yeah.
Okay, ma'am, can we start?
Yes, please start, yeah.
Yeah. Very good evening, everyone. I'm Ritu Abraham from Medisage e-learning, a leading platform dedicated to empowering medical professionals through knowledge sharing, expert insights, and digital innovation. In our today's esteemed Pearl series, it gives me immense pleasure to welcome Dr. Ritu Santwani, a name very well known to our Medisage community. Dr. Ritu, a highly respected obstetrician and gynecologist, infertility specialist, and sexologist, Dr. Santwani holds qualifications including MBBS, MD, FICOG, FIAOG, and Art Singapore. She is the founder and CEO of 360 Degree Healthcare Studio and is recognized among the top 50 influential doctors on social media. Dr. Santwani also serves as the co-founder of MAAM and is a board member of SWWC, bringing a wealth of expertise in women's health. Today, ma'am will be sharing her clinical experience and expertise on a very vital topic, NAD therapy, emerging trend in anti-aging medicine. So without any further delay, I'm delighted to hand over the session to Dr. Ritu. Over to you, ma'am.
Yeah. Thank you, Neetu, and thank you, Medisage, for providing the platform. Friends, today I am going to share or discuss with you all a very important topic related to anti-aging. These days, lot of patients are approaching to us, all have a query for this longevity. So they might have seen some reels in the social media or have seen some video. After that, they all have a lot of queries related to NAD. There is a lot of queries are coming. Madam, is it safe to take the oral NAD and how long we can take? Is it a miracle molecule or is it safe to take a IV NAD therapy? So related to all that confusions, so I have made a presentation of today. Really, NAD act as a, we can say a youth of fountain. So a lot of miracles changings are seen with this NAD therapy. So without further delay, I'm sharing my slides. Friends, I've made the slides on what are the practical problems we are getting in our daily day-to-day OPD. So yeah. Mm. Slide is not moving. It will move. Yeah. So thank you once again, Neetu, for the introduction. Friends, my all presentations always start with my Mata Durga Rani Stuti. Ya Devi Sarvabhuteshu Chikitsa Rupena Sansata Namastasyai 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 Namo Nam. So friends, yeah. So now what is this NAD therapy? What is this NAD therapy? What is this? Is a new trend in the anti-aging. So unpacking the science and potential of this popular longevity innovation. I have divided it into 4 chapters. In the chapter 1, we will learn about what is the science behind this NAD. So, friends, what is this NAD? As we all know, it is the energy production, power, cellular metabolism, DNA repair, maintains the genetic integrity, cellular health, regulates the vital processes. Nicotinamide adenine dinucleotide is a vital coenzyme found in the every cell. It is crucial for energy production, DNA repair, and maintaining the cellular health. NAD exist as oxidized and reduced NADH forms, which cycle to power the essential metabolic processes. This NAD and aging, the cellular decline, 50% NAD levels half by 50, linked to the aging signs and cellular dysfunction. And because of 3 times more, causing the increased oxidative stress, weaken the defenses, and accelerate the cell damage. This decline in NAD triggers a cascade of aging issues, regular cellular energy from mitochondrial dysfunction, cell damage from oxidative stress, and ineffective DNA repair. This leads to visible aging signs, decreased muscle strength, and increased risk of age related diseases like neurodegeneration and metabolic disorders. The cellular fountain of youth. This nicotinamide adenine dinucleotide is a critical coenzyme found in every cell, essential for cellular vitality, health, and longevity. It's crucial for metabolic pathways and energy production, particularly in mitochondria, where it facilitates the ATP generation, sufficient NAD plus, and ensures cells can produce energy, maintaining the overall cellular performance. So now how it acts. So we will see that how it is essential for cellular repair and maintenance. As we all know, related to this certinins, the longevity genes, NAD fuels the statins, often called longevity genes. These enzymes regulate the critical processes like DNA repair and cellular aging. Ample NAD plus ensures they effectively maintain the cellular health. Now, related to this PARP enzymes, which are considered to be the guardians of DNA, this PARP enzymes, NAD fuels this PARP enzymes critical for detecting and repairing the DNA damage. It provides energy for these mechanisms, preventing harmful mutations and protecting genomic integrity. The multifaceted cellular fuel, it is NAD is considered to be unique in anti-aging due to its broad involvement. It empowers the cell's inherent machinery to repair and regenerate, making it a cornerstone for overall cellular longevity and resilience. Now, what is the PARP enzyme? So, as I have just mentioned, that this poly ADP ribose polymerase enzymes are vital for cellular health, acting as molecular first responders to DNA damage and initiating the repairing mechanisms. So, now coming to the next chapter, that what is this NAD therapy? What is it? So, this NAD therapy boosts cellular vitality by increasing the NAD levels through various delivery methods, either oral supplements, IV infusions, or injections. So, oral supplements are available in the form of the NR and NMN, and IV infusions directly bloodstream delivery for maximum impact. Injections targeted delivery via subcutaneous or intramuscular shots. Then benefits of this increased energy and mental clarity, improved metabolic function, enhanced DNA repair, reduced sign of aging. So how this NAD therapy works biologically. So we will take one by one. NAD is the precursor intake. NR or NMN enters the blood body via supplements or infusions. Is it available in the natural dietary source? Yes, I will show some presentation related to that also. So cellular conversion, precursors convert to NAD in plus inside the cells. Then cellulogen activation, elevated NAD activates the cellulogens, key longevity enzymes, cellular rejuvenation, boosts the mitochondrial function, reduces inflammation and improves repair. The early human trial shows the improvements in exercise, insulin sensitivity, and metabolic health, suggesting the real potential. Now, understanding this daily NAD plus requirements is a vital coenzyme essential for energy, DNA repair, cellular health. Levels naturally fluctuate and decline over time, impacting the biological processes. Natural levels and function, NAD plus drives over 400 metabolic reactions. Optimal levels are seen in young adults declining after the age of 25. Hmm. Age-related decline. So, NAD levels can drop by 50% by middle age, contributing to aging signs like reduced energy and cognitive impairment. General considerations: NAD functions universally, though minor gender specific metabolic differences exist. They, the need to counteract the age related declines is consistent for all. Then, what are the supporting needs for this? Maintaining the sufficient cellular NAD plus involves the lifestyle choices like diet and exercise. Precursors like NMN or NR can also boost the levels. Understanding these factors enables the informed choices about supporting NAD plus levels and promoting healthy aging. Now, how to fuel this? Fueling NAD naturally, dietary strategies for cellular health. So, beyond supplementation, diet is crucial for healthy NAD levels. Nutrient rich foods are beneficial. Eating patterns naturally support. So, now what are these? As we all know, the first and foremost is a tryptophan rich proteins. So, tryptophan, as we know, is an essential amino acid found in eggs, dairy, nuts, and seeds, and it is converted into niacin, vitamin B3, adding the NAD plus synthesis. This vitamin B3 niacin powerhouses, excellent sources are the lean meats, fish, whole grains, legumes, mushrooms. Now, what are the compounds which boost this NAD? So, a specific B3 form like NR and MN directly support the NAD production, which is found in milk, yeast, and vegetables like broccoli, cabbage, and avocados. Then, beneficial dietary patterns, caloric restriction, intermittent fasting, and ketogenic diets influence the cellular metabolism. These patterns can upregulate NAD pathways, supporting cellular resilience and longevity. A balanced diet rich in these foods, strategic eating patterns can powerfully enhance the body's natural NAD production and overall cellular vitality. Daily dietary strategies for enhanced NAD levels to naturally boost NAD production focus on foods rich is the key precursors. So now I will take one by one. First and foremost, the tryptophan rich foods, the niacin precursors. In this, the chicken around 250 to 400 mg, two eggs, large eggs, 1 cup of the milk, nuts and seeds, especially the pumpkin seeds and almonds, are supported to be having very good. Then, coming to this, again, the studies have shown that NAD precursors for this cow milk, yeast, broccoli, cabbage, avocado, and edamame is considered to be a good sources. Now, in this slide, we can see that how we can include these in diet, and these all are beneficial. So, boosting the NAD levels naturally with these key vegetables and fruits for energy and cellular health. So, first and foremost, broccoli. We all know these days broccoli is very much in the limelight. Lot of celebs are showing the video related to broccoli in the weight loss for for this anti-aging. So, it is rich in NMN, a direct NAD precursor, essential for energy and repair. Recommendation is around 1 cup, 90 gram daily. Then cabbage contains the NMN supporting the efficient NAD plus and metabolic functions. Recommended also 1 cup. Avocado, which is considered to be a fruit for the rich people. Uh, it helps to maintain the robust NAD and cellular longevity. Recommendation: half to one whole avocado daily. Add mame. Uh, we all know these are also very popular. 1 cup daily. Mushrooms, which are considered a good source of the proteins. 1 cup of the sliced mushrooms. Spinach supports the overall metabolic processes, utilizing the NAD plus and B vitamins and nutrients. Now, the studies have come. This NAD supplement dosage and dietary guidance. Recommended daily dosage typically ranges from 250 to 500 mg. Some studies may explore a higher doses for specific outcomes. It is generally advised to take NMN in the morning, often an empty stomach, for maximum absorption. If any GI side effects are noted, then only after the light breakfast it is recommended. So the two preparations which are available, NMN, the nicotinamide mononucleotide, and nicotinamide riboside. The dosage is around for this NMN is 250 to 500. For NR is 300 to 600 mg is usually are recommended in the early morning. So now, is it some dietary interactions or some food instructions with these? So usually, a lot of studies have come that the liposomal preparations are good for enhancing the absorption, potentially the reducing the impact of food timing. Only thing, if the stomach is very sensitive to for that, if you're feeling nausea or vomiting after this, so better to take these with the food. Excessive alcohol intake is known to deplete the NAD levels, which could counteract the benefits of supplementation. Balanced diet of fruits, vegetables, and lean proteins. Medication, of course, always to consult the healthcare professional before starting any of these supplements. Yes, hydration. Hydration is considered to be very good for all the bodily functions, including the cellular processes supported by NAD. So, in nutshell, if I can say for anti-aging, yes, the intermittent fasting is very important. Caloric restriction is very important. Yes, NAD supplements are very important, and hydration, proper hydration of the body is also important, and the lifestyle changes in which. Yeah, of course, the quitting of the smoking and moderation of the alcohol intake is also included. Now, whether this can be given IV or oral, so intravenous NAD therapy increasing the popular wellness treatment aimed at boosting the cellular regeneration, energy, and overall health. By delivering NAD directly into the bloodstream, it bypasses the digestive system, allowing a higher bioavailability and more immediate effects compared to oral supplements. This guide covers the key aspects of NAD therapy to understand what it entails. So, so now what to expect during the treatment with NAD settings? Usually, it can be given in the clinic. Yes, once we start this infusion, some may feel a little flush or feeling of warmth or slight nausea or some headache. Yes, while giving this NAD therapy, yes, vital signs to be monitored, and the whom we have started the drip can often relax, read, listen to music, or work on the laptop also during the treatment can be done. Now, how frequently we have to give this NAD therapy? So, a single IV NAD therapy session can last anywhere from 2 to 4 hours, depending on the dosage and individual tolerance. For higher doses or specific protocols, session might extend 6 to 8 hours. The frequency of the treatments varies widely based on individual needs, healthy goals, and advice of the healthcare provider. Some protocols might involve the daily sessions for several days or weeks, while others might be weekly, bi weekly, or monthly for general wellness and anti aging purposes. So, anyhow, once we are giving the first IV therapy of NAD, yes, we have to tell the patient that they have to come for the minimum for the time period of the 3 hours, because first shot always we give slowly from 2 to 4 hours, and some patients, as we all know, as with the saline, some patients may feel little cold. In that cases, we have to give very slowly, maybe extended up to the 6 hours also. Now, who is the good candidate for this NAD therapy? This NAD therapy may be beneficial for the individuals looking to boost overall energy and combat chronic fatigue, improve cognitive function, and mental performance, support recovery from addiction, alcohol, opioids, and stimulants, minimize the effects of aging, aid in chronic pain management, accelerate the muscle recovery after intense physical activity. Hmm. Hmm. So, the results has been reported for improving the increased energy levels and reduced fatigue, improved mental clarity, focus, and cognitive function, enhanced mood and reduced symptoms of anxiety and depression, support from addiction recovery, reducing the inflammation and pain, neuroprotection, and support for neurological conditions. While generally considered safe, some individuals may experience side effects. These are typically mild and transient: discomfort during infusion, flushing, nausea, and head pressure, tenderness or bruising at the injection site, temporary dizziness or lightheadedness, fatigue after the session. Rarely, more severe reactions can occur. Usually, these all therapies will be given under the medical supervision. This NAD therapy, who can give? Yes, of course, any of us who is a licensed medical professional with the clear protocols for the patient assessment and monitoring, transparent pricing, and treatment plans. Now, cost consideration, the cost is usually high. It all depends from clinic to clinic location and the number of the sessions. Um, so basically, this NAD dose therapy ranges from 250 to 1000 mg per session for anti-aging. And in the cases where for the chronic conditions, the doses may be little higher, 750 to 1000 mg via drip over a period of 2 to 6 hours. So now factors what influence this dosing. Yes, of course, the patient's age, weight, and underlying medical conditions. That all depends that how frequently you have to give. Then starting versus the maintenance doses. Typically, the therapy begins with a loading dose, which are often higher and administered more frequently, daily or several times in a week, to a rapidly elevate NAD levels and achieve the initial therapeutic effects. Once the desired levels are reached, patients may transition to maintenance doses, which are generally lower and administered less frequently to sustain the benefits and support of ongoing cellular friction. Mm. Then safety consideration. So for this has to be yes, as I already mentioned, the nausea, cramping, and the chest pain may be reported in some patients. Only the contraindications are during pregnancy, and of course, the patient is on some medications in which the excessive hydration can't be given. In that conditions, we have to avoid. So now this oral NAD therapy can be given daily as a supplement, and some side effects, as I again mentioned, the some GI discomfort has been only reported. Then IV therapy, also I have just discussed. So I will show better. Yeah. So now what are the myths versus facts related to this NAD therapy? First and foremost is the that NAD therapy can cure and all the health problems, and it is having some having unsafe and having several side effects. So here we can come friends on the facts. It supports the vital processes, but it is not universal cure. It is crucial for energy production, DNA repair, cellular longevity, and offers the benefits for a range of health issues. This therapy is generally safe with manageable side effects. Infusions may cause the temporary discomfort if administered very quickly. Oral supplements generally having a few side effects. It benefits have seen all age groups. Oral NAD precursors are effective in increasing the NAD levels. Yes, of course. NAD research is extensive, highlighting and its fundamental role in health. Still, lot of research is going on this. Yes, the studies have shown the critical role of NAD in metabolism, cellular repair, and healthy aging. The cost reflects the specialized administration, quality ingredients, and professional oversight, and offering the significant potential health investments. NAD supplements duration and effects. So this effects, while the studies have shown that 8 to 12 weeks may show the initial benefits, many proponents suggest that long-term use, 6 months to several years, to experience the sustained effects, especially in the areas like cellular repair and energy metabolism. Then, when the effects typically begin to show, a timeline for benefits, usually some users report to feeling the subtle increasing in energy or improved sleep within a few weeks, 2 to 4 weeks. More profound benefits, such as enhanced cognitive function, better metabolic health, noticeable improvement in skin elasticity, and often become apparent after 2 to 3 months of the consistent use. So, again, is it like that once we stop taking this NAD supplements and again the problems will come back? So I will divided this into three. Yeah. So yes, the studies have shown no. Once you take the this NAD supplements and again if you are omitting in between, it is not necessary for sustained benefits. If you can take the NAD supplements needed to be taken continuously along with the lifestyle factors, as I already mentioned, intermittent fasting, caloric restriction, and alcohol and smoking to be limited. So, interrupting the regimen can lead to reversal of the gain. The NAD supplementation is of a more long commitment for those seeking continuous anti-aging and health benefits. Mm. Now, studies have shown that cycling, some individuals may choose to cycle NAD supplements, taking them for 3 to 6 months, and then again taking a break for a month or two. This approach is sometimes preferred to prevent the potential tolerance. Studies have suggested that NAD tolerance as a significant issue. It can also be a practical approach for managing costs. Means you have to give better for 3 to 6 months, then give a break, and then again you can start. Then studies have shown the market and popularity search. Yes, so now it is constantly increasing. The annual growth has been goes on increasing. The studies have shown for this oral supplements, for this oral NR and MN, of course, lot of anti-aging creams, IV therapies. Now these days, lot of nasal sprays have also been reported. I consider to be a billion-dollar industry. A lot of celebs we can see are endorsing this. It is not just about looking the younger, it's about the feeling energized and optimized from inside out. Common sentiment among the NAD therapy advocates. So not about looking younger, but feeling energized and optimized from inside out. So, lot of Hollywood celebs had given already a lot of testimonials related to this. Now, still a lot of scientific debate and expert opinions. So, these are some I have put for to, especially one is from Dr. Neil Polvin. Unclear if NAD infusions offer benefit. It's uncertain if NAD effectively enters the cells where needed while the clinical research gap, according to evidence, favors the oral NAD precursors over IV therapy. More rigorous long-term human studies are needed. So, still, lot of studies are going on. Still, for the official FDA approval, still is not there. Long-term effects, optimal dosing, and potential side effects remain the inadequately studied. So, till now, the studies have shown it improves the metabolic markers, reduce fatigue, enhanced exercise capacity, cellular biomarkers. It's a real-world impact and patient stories. So, a lot of patients who have benefited by this, especially in the NAD therapy has been a good role for the chronic disease support, regenerative medicine, organ function restoration, and metabolic dysfunction recovery. So, the future of this NAD therapy and anti-aging. Looking ahead, innovation and challenges, enhanced bioavailability, regulatory scrutiny, combination therapies, personalized dosing, disease prevention, and athletic performance. Conclusion that NAD therapy, hope, hype, are here to stay. So, critical biological importance NAD is vital for cellular function, energy, and DNA repair, established science. Uh, Exciting but unproven, promising in early studies, requires the rigorous clinical validation, consume empowerment, stay informed, consult experts, and weigh benefits versus risk versus cost. The future is bright, but patience and scientific rigor must be guide us forward. So, NAD therapy is promising scientifically. Sorry. Uh, is scientifically grounded a step in the quest for healthy aging. Continued research will clarify its full potential for human health and longevity. So, with this, I will wind up. I know the topic is very vast. I tried to somehow finish in half an hour, and still, the lot of research is going on. So, lot of studies are going on. Yes, I have started using in some of my patients and getting the good results, but still lot and lot of to read in this and to explore for this. So thank you all for your interest and time. Huh.
Yeah, ma'am. So it's already 9:30 and we have some viewers' questions. Should I take it up for you?
Yes, yes, take it, whatever the relevant, I will definitely
All
answer.
right.
Yeah.
All right, ma'am. So the first question is, have you integrated NAD therapy alongside other anti-aging or metabolic interventions such as peptide therapy, antioxidants, or hormonal modulation? How do
Yes,
you
I
ensure?
yeah,
Yeah,
yeah. Again, complete your
yes.
question. How do you?
How how do you ensure synergy and safety?
See, yes, of course, I had given this NAD therapy along with the peptide and anti-aging. Yes, in some patients, recently I have tried with the hormones also. Yes, depending, the very good question related to safety. Yes, that all we will do because there is no such nothing such like made a tailor-made protocol along with the depending on the every patient's requirements and what are the other comorbid conditions. I fix the protocols. Yes, basically we will do some blood test, and if all the tests are coming normal, yes, of course we can start this therapy.
All right, ma'am.
Yeah.
So the next question is, from a clinician's perspective, what are the biggest gaps in current evidence or regulatory clarity
Yeah.
around
So
NAD therapy?
yeah. So this is again, as I just shown in my slide, still the FDA approval is not there. So what we have started by learning or by listening some webinars or by seeing some videos or mostly his I to have take training for this, especially in the Singapore. So we have seen that lot of new protocols are coming these days. Yes, still it is not FDA approved, so yes, and lot of doctors are also not aware of this therapy. So this therapy is still new and lot of awareness and lot of studies are also needed.
Right, ma'am. Our next question is, I think you have already covered it in your PPT. In your clinical experience, what measurable improvements have you observed in patients after undergoing NAD therapy,
Yes,
especially
yes.
in energy metabolism and cognitive function?
Yeah. So, yes, I have already covered. Yes, definitely the ones the patients, usually the patients who are approaching to us, especially the menopausal ladies, or who are telling that, ma'am, there is total lack of energy. And even though all the menopausal ladies are not obese, some ladies are coming to us who are lean and thin, and they are feeling that total lack of energy, forgetfulness, and some cognitive functions also problem. So yes, of course, there is a difference. But remember, always when we are giving this therapy to the patient, we have to explain them very correctly that there will be nothing like a miracle after a one therapy. Yes, in some patients, you will get a very good results after a one IV infusion only. But in some patients, usually it take times after 2 to 3 of injections, they will start improving better, feeling
Got it,
better.
ma'am.
Yeah,
Yeah, so that's all the
yeah,
questions from your side.
yeah. Because
So
this is a
thank
very
you,
new
ma'am. Thank
topic.
you for
Yeah, yeah.
yeah, ma'am. Continue. Please
Yeah,
continue.
yeah, yeah. I'm saying this is a very new topic. Now, this is very new thing which has emerged here. So, still lot of research and lot of studies has to be done and to be do. Uh, Further, by more studies, we can see that what more good results it is coming. I will come with someone another also interesting lecture soon in your platform. We'll let you know. So, thank you once again
Yes,
and
yes.
thank you, Neetu. Yeah.
Yeah, thank you. Thank you so much, ma'am, for this wonderful session that you had done on NAD therapy. To all our viewers, thank you for joining us today. For those who have missed the session, kindly go to the past events in our Medisage app and do see the recorded session. Thank you again, ma'am, for your
Bye
time.
bye. Good night.
Bye bye. Good
Bye.
night.